In many parts of the world, rural and indigenous communities live close to nature, yet far from the basic services that much of the world takes for granted. Clean water, sanitation, healthcare, and consistent education are not always easily available. Families often struggle with poverty, fragile housing, and health risks caused by their environment. This lack of resources creates serious challenges for health and hygiene. Preventable diseases spread quickly, children are forced to grow up under difficult conditions, and families must constantly fight against problems that could be solved with the right support. In this script, we will explore the connections between health, hygiene, the environment, and rural living conditions. We will also look at how these challenges affect education and how simple solutions can transform lives. Along the way, we will highlight jigger disease, a painful but preventable condition, as one example of how poor sanitation and poverty impact rural families. The importance of health and hygiene. Health and hygiene are at the center of human dignity. Without them, people cannot live to their full potential. Something as basic as clean hands, safe drinking water, and hygienic living spaces can make the difference between life and death, especially in rural communities. In many villages, water is fetched from rivers, ponds, or shallow wells. These sources are often shared with animals, making them prone to contamination. Without clean water, cooking, washing, and drinking all carry risks of disease. Hygiene also depends on proper sanitation. Yet in many rural areas, toilets are absent, forcing people to relieve themselves outdoors. This practice contaminates soil and water, spreading infections such as diarrhea, cholera, and intestinal worms. Children are especially vulnerable, and illnesses can interrupt both their education and their development. Environmental conditions and their impact. The environment shapes the health of rural families in powerful ways. Houses may be built from mud, sticks, or thatch, with floors that remain damp during the rainy season. These floors provide a breeding ground for parasites and insects. Mosquitoes thrive in stagnant water near homes, spreading malaria, while flies transmit infections from waste to food. Poverty often limits the ability to improve housing. Families cannot afford cement floors, strong roofs, or proper ventilation. Cooking indoors without chimneys exposes families to smoke, increasing respiratory diseases. When waste disposal systems are lacking, garbage piles attract rodents and insects. These conditions combine to create an unhealthy environment where disease spreads easily. Jigger disease, a preventable example. Among the many health challenges faced in villages, jigger disease stands out as both painful and preventable. Jiggers are tiny sand fleas that burrow into the skin, usually in the feet. Once inside, they swell and lay eggs, causing itching, swelling, pain, and sometimes secondary infections. Children who walk barefoot are especially at risk. Jiggers can make it difficult to walk, play, or attend school. In severe cases, untreated infestations may lead to disability or even death. The tragedy of jigger disease lies in its preventability. With proper footwear, improved flooring, and basic hygiene practices, infestations can be avoided. Treatment is also simple when tools, medicines, and healthcare workers are available. But in many rural areas, poverty and lack of medical access make prevention and treatment difficult. Jigger disease reminds us that small problems can grow into major ones when basic resources are missing. Education and its link to health. Education is one of the strongest tools for breaking the cycle of poverty and disease. Yet in many villages, children face obstacles that prevent them from learning. Illness, hunger, and poor hygiene are common reasons why children miss school. Families that cannot afford uniforms, school supplies, or fees may be forced to keep children at home. Even when children attend school, poor health makes it hard to concentrate and succeed. Health and education are deeply connected. A child who is healthy can walk to school, sit comfortably in class, and focus on learning. A child who is sick, hungry, or in pain cannot. By improving hygiene, nutrition, and healthcare, communities also improve education. The role of community support and generosity. Despite the struggles, rural communities often show strong resilience. Families share resources, neighbors help each other, and communities work together in times of need. External support through donations, education programs, and health supplies also plays a vital role. For example, simple donations of shoes, clothing, and medical supplies can have a life-changing impact. Access to scalpels and medical tools enables healthcare workers to treat conditions like jigger infestations safely. Educational support, such as uniforms, bags, or school fees, helps children remain in school and feel included. Acts of generosity, whether from within the community or from supporters abroad, demonstrate that change is possible when people care for one another. Challenges that remain. While generosity provides immediate relief, long-term solutions require systemic change. Many challenges remain. Limited access to healthcare. Clinics may be far away, understaffed, or unaffordable. Poor infrastructure. Roads, schools, and water systems are often weak or missing. Poverty. Without steady income, families struggle to invest in better housing, nutrition, or healthcare. Environmental risks. Deforestation, soil erosion, and climate change worsen rural hardships. Addressing these issues requires commitment from governments, organizations, and communities themselves. Practical solutions for healthier villages. Although challenges are great, many solutions are within reach. Here are some practical steps that can improve health and hygiene in rural communities. Clean water systems. Installing boreholes, protected wells, or simple filtration systems reduces waterborne diseases. 3. Sanitation facilities. Building latrines or eco-toilets prevents contamination and promotes hygiene. 3. Housing improvements. Replacing mud floors with cement, improving roofing, and adding ventilation make homes safer and cleaner. 3. Footwear and clothing. Providing shoes protects children from jigger infestation and other soil-borne diseases. 3. Health education. Teaching families about hand washing, waste management, and nutrition empowers them to take charge of their health. 3. School health programs. Offering meals, vaccinations, and hygiene kits at schools supports both education and well-being. 3. Community cleanup days. Organized efforts to clear waste and stagnant water reduces breeding grounds for insects. 3. Small improvements, when multiplied across many families, create lasting change. Global responsibility. While these issues may seem local, they are part of a larger global picture. Health and dignity are human rights, and the struggles of rural communities remind us of the inequalities that exist worldwide. Every child deserves clean water. Every family deserves safe housing, and every person deserves access to health care. Awareness is the first step. When the world understands the daily struggles of rural families, compassion grows and action follows. Support can come in many forms: donations, advocacy, education, or even volunteering skills and time. In the end, the key law in the story of rural life is one of resilience, struggle, and hope. Families work hard to survive, children dream of education, and communities hold together despite hardships. Yet poor health, hygiene, and environmental conditions hold them back from achieving their full potential. Diseases like jigger infestation are powerful reminders of how poverty and neglect make preventable conditions deadly. At the same time, they remind us that solutions are simple and within reach. By investing in clean water, sanitation, education, and healthcare, we can transform not only villages, but entire societies. Rural families deserve the same dignity and opportunities as anyone else in the world. Health and hygiene are not luxuries. They are basic human rights. When we work together to provide them, we build healthier, stronger, and more hopeful communities for future generations.